there are a few threads there about how will SEA ensure that smaller locally based charities are not overlooked in favour of larger national charities or bigger organisations as the SEA work unfolds. And there was also a question in the chat sort of adjacent to that about should organisations be thinking about joining collectives or grouping differently to try and support the model?
Really great questions. Obviously it's challenging working from Wellington across a range of small organisations, numerous in number, and we recognise that this is not necessarily going to be something we can solve overnight. There are a couple of ways that this challenge could be solved in time. The most obvious one, we think, is movement towards community-based commissioning. Ultimately, in communities, people know what's working. They know the organisations that are well placed to make a difference on the kinds of opportunities that or outcomes that we're wanting to provide. We will have some capacity to deal with small organisations, but equally we need to acknowledge that for small organisations it can be really challenging to develop the evidence base to support the kind of investment that we're talking about. We have seen some good examples of collectives where smaller organisations have been able to come together and build good capability around data and evidence. And we also are going to be working on providing some of the tools that will assist organisations to understand their impact in a way that might be hard to do if they were in the space of needing to build their own data systems to do it. So there's more water to go under the bridge here, and I think we need to reassure and say, nothing's going to dramatically change overnight. This is will take time to build into a new way of working. And so for those smaller organisations that don't necessarily know how they're going to be able to front up to this, please don't stress at this point in time, because the fund is going to start in one place and over time it will be able to enable more. Do you want to add to that, Jay?
I think the only thing I'd add, Belinda, is we're not looking to force or coerce organisations together. I think one of the initial initiatives that we have funded is based around a collectivised model with a kind of hub and backbone organisation, and we're kind of interested in seeing how that kind of model plays out. And they've had to do a lot of work on the tools that enable that, as well as the governance arrangements and so on in support of it. I think there's real benefits at a community level of people coming together and working like that. I don't need to tell the people on this call that, but it's not something that we're going to kind of push for or kind of do anything coercive on. That's not how collectives work.
Yeah, cool. That's very reassuring. There are lots of questions that are coming through on the thread of what will the criteria be? How will outcomes be evidenced in short and long periods? How is the model going to kind of work in terms of measuring impact and deciding on what is measured and valued and what is seen as a longer term outcome? Is there any signals here on how that model is evolving? And also, you'll have enormous expertise on this call, so I really want to reinforce that you will have people who are already doing some pretty fantastic things that they are evidencing themselves. So I think there's kind of two prongs. How's the model evolving? And if you've got some really wonderful, already evidenced ideas, where do you go to kind of connect up with your team?
I'll start and then I'll hand to Jo to speak a bit about what the engagement might look like, when an application presents to the fund in this space. So ministers will set outcomes later this month. Minister Willis has been upfront that those outcomes will be tied to things like government targets, the child and youth strategy, the family violence strategy, Te Pai Ora, and you can imagine those outcomes are fairly broad in nature. It's highly likely that ministers will also select priority cohorts, which speak about some of the people in our community where getting the right support will make the greatest difference. And those cohorts will apply particularly to the new initiatives pathway. For contract consolidation, where you have organisations that have many contracts, the frame for that would be broader and thinking about the wide range of outcomes that the Social Investment Fund is interested in delivering. The SIA has its particular superpower, the ability to do advanced population analytics, and obviously the IDI, integrated data infrastructure, is a key tool for us in that. Most of you will know, I'm sure, but for those who are unfamiliar, the IDI is a large, anonymised, highly protected data set that gives us insights about what's happening in our population. And there are ways that we can use the IDI to understand impact from a particular set of services, providing the volume of people going through those services is high enough to be able to see that. So that's one of the methods, and evaluation will be built in from the beginning, appropriate to the circumstances. But Joe might be able to probably speak a bit to some of the specific kinds of conversations we've been having in the early stages.
Yep, sure. I mean, effectively, we're having to operationalise a lot of the theory and kind of guidance that the SIA has worked on for years, and that gives us that advantage along with the people in the building that have got a deep level of evaluation expertise, far greater than mine. So forgive me if my little example falls short of what you might want. Basically, what that means in terms of working with a new initiative is to look at that theory of change at the initial stage and looking at the evidence base behind that theory of change. And as part of the first panel for choosing the first view, and something we will continue to do, we had some deep expertise in that space, both from the kind of econometrics side, but also from the public health space at that first panel. And basically for initiatives that put forward theories of change, we dug underneath that, looked at the evidence, looked at where that was. Ultimately, we then agree a set of measures and evaluation approach for that looks at that theory of change. Many organisations will already have a great deal of work in that area. Others will need a bit more support than others. And basically, we then create an evaluation plan that sits between us. And for some organisations, again, they might have evaluation partners that work with them. And where they don't, we may be able to provide either some internal or external support for that evaluation. And I'm just trying to reiterate here just how important that part is. In terms of the outcomes, and there's a couple of points in the chat here that I think I can also address at the same time. Obviously, the outcomes for early identification of people with kind of very young children with potential autism, for example, we're not going to see the impact in terms of their success at school for 4, 5, 6 years. And actually, as part of signing up to these kind of investments, that's the commitment that you're making, that you're going to work through that level of timescale. But you do get to see, because of that theory of change, some of the intermediate outcomes and some of the developmental evaluation approach you can put alongside that also gives you that indication. So I'm reiterating again and again here, this is the big shift. It's putting that evaluation in right from the start, designing things around it, agreeing it in partnership. And ultimately what these agreements are, it's not a master-servant contract relationship, it's a learning partnership. It's how do we work together to work out what works and do more of it so we have more greater reach and impact.
The other thing worth noting quickly on this point is we know that the outcomes that government will tend to see and focus on end up often at the deficit end of things. And that's just a reality of the life events that cause people to come into contact with government services. But we know that out in communities, there's a different set of aspirations and outcomes that people are working towards. And similarly for whānau, there'll be a wide diversity of things that they want to achieve. Our theory here is that through the mechanism of outcomes-based contracting, it's possible to have a conversation about outcomes where a community provider might say, well, these are the outcomes that we're aspiring to for the people that we support. And this is how we think that they will enable the delivery of the outcomes that government cares about. So we're not trying to prescribe for communities or whānau what outcomes they should be focused on, so much as saying, these are the things that government is looking for. How does that relate to the things that you're focused on? And then through the mechanism of an outcomes-based contract, without the usual prescription, being able to find the alignment and benefit outcomes on both sides of that equation.
Our sector's largely government funded, so a lot of charities and NGOs on this call. How does the partnership and investing in the build on that infrastructure look like? Because I think you kind of get what you pay for in terms of how government has maybe not invested as much as it could have in those data sets and gathering and valuing the evidence that organisations have. How does that investment picture look in this very lean sector to actually come to the party and be able to meet those expectations?
Yeah, one of the things that we have, I think, we government have forced on the sector over time is pouring as much resource as possible into the delivery of services and frankly, compliance and the maintenance of contracts, rather than on building the capability required to have mature organisations that can grow and impact into the future. And there's so much wastage at the compliance end of this. If we could see some of that investment going towards the capabilities that will give us confidence that outcomes are being achieved, it would be a great step forward. So we would envisage the fund allowing more space to grow capability in organisations, in part through longer terms of contracting, where there's less focus needed to go into how we're going to make sure this contract rolls over next year, and more into how do we ensure we've got the capability required to deliver the outcomes that the contract envisages. It's going to take time, clearly, for organisations to be able to reposition, but very clearly, if we want sophisticated ways of working at the coalface and to see outcomes achieved, then there's value in that, and government should be willing to cover some of the cost of that.
Yeah, nice. There's a lot of questions too around the unique outcomes and value added by the sector, but specifically on iwi Māori, hapu, kaupapa Māori focused services. Just where we often look to overseas models, but how are we also going to make sure that we are incorporating Indigenous models and Aotearoa specific approaches that we've grown here and we know work?
Yeah, I don't want to do all the talking here, and I'll hand over to Joe in a moment, but I think the key point here, one of the key points here, is by not prescribing from Wellington the activities, we allow a lot more space in community for the things that work to be done. And through good evaluation to understand what's working in order to do more of it. And so there are a lot of approaches out there that we all strongly suspect are making a difference. Social investment is about proving that out so that further investment could follow. Obviously, there's a level of tension that can come into the question of sort of Western science versus mātauranga or community knowledge. And that's something that we need to continue to work with, and I think we would strongly acknowledge that at times there are things out there that are working that we don't know exactly in a scientific sense why they're working, or they haven't been evaluated that way, but we can see that they are, and there's room for that in this model. But Joe?
No, that's bottom. I mean, effectively, when we're looking at those theories of change at the early set, we're not looking at that solely through a kind of Western science perspective or a kind of prescribed model from the US or whatever. Absolutely not.
Yeah, that's terrific. I think there is just going to be a lot of questions on the model, which I'm sure are really valuable, but it would be good to know, and we can talk offline about what steps people can take if they've got information to feed in. I also just want to do a plug before I hand over. I know Zoe will have been taking kind of her own outtakes from this, but just not to forget the human value of things and the intangibles that the sector provides. So I think sometimes we do look to the bones of an individual intervention, but what you also have is amazing humans wrapped around that mahi, that if we could capture that, that would probably be all your work done potentially, team. I'll just make sure I've covered off the other questions. I think you've answered, so I just want to make sure we're clear on the requirement for any kind of impact evaluation before people would enter, but you seem to have clearly reassured us that that wouldn't be a requirement of accessing the fund that you've already got an impact report. So I know that'll reassure people on the call. I'll just make sure.
Very quickly on that, the most useful thing is for organisations to be clear on the outcomes they're delivering, for whom, with what theory of change, and how that impact might be understood or evaluated. Those are questions that can be answered through an impact report process, but the end dollar value of that process is much less interesting than the inputs that come along the way through that sort of simple frame that I've just articulated.